Hello everyone, Amanda Williams, MD, MPH, here with you today to talk about a very important issue that many men experience. And this is a topic that for many men they find incredibly embarrassing. They don't want to discuss this, but it's very common. So I wanted to bring this to your attention today because I know I have talked to many men, and men would come into the store and kind of skirt around the issue a little bit, ask them, what are you after in terms of what supplement are you looking for? And it was always, kind of hinting around to what the actual issue is. And it's not something that you should be embarrassed by. There's many different reasons as to why men can experience erectile dysfunction. And we can look certainly at many of the chronic disease states that we know can actually exacerbate this condition. So when we're looking at issues with cardiovascular disease, certainly we know blood flow becomes a major factor in this. We can look at diabetes when we're looking at the, once again, impact to the vascular system, but also to the nervous system. So there's a lot of different components, certainly obesity. There's a lot of different factors that we know are very, very prevalent in the United States when it comes to these different disease states. And then we have to look at just the aging process alone. So this is a really profound fact. And this comes from the Massachusetts Male Aging Study. And what they found in this study was that 40% of men who are of the age of 40 years old will have, to some degree, erectile dysfunction. And then when we look at men who are 70 years old, that number then goes up to 70%. So men in their 40s, a good 40% of them will experience some type of erectile dysfunction. Men in their 70s, 70% of those men will experience some form of erectile dysfunction. We also know that every single year, annually, there's at least 600,000 to 1 million new cases of men who are seeking out treatment for erectile dysfunction. Now, we also have to look not only at those chronic disease states, but many of the medications that men are taking because of those chronic diseases. So a lot of the high blood pressure medications certainly can play a role into having issues with either libido or also with the actual functionality of actually getting an erection. So these are things that you have to be cognizant of. Maybe it's your medication that's actually compounding or making this problem worse. We certainly know that many of the SSRI drugs, the selective serotonin reuptake inhibitor drugs, which are given to people for their mood disorders, so generally speaking, depression. And then one of the primary side effects is going to be low libido. So this can also be an issue. So I want to talk about the Men's Edge formulation, because for many men it may be kind of a combination. It's, maybe it's partly the erectile dysfunction, but it's also maybe that desire has gone down and that low libido has actually kicked in. And oftentimes that can be a defense mechanism, because if you're having a problem in terms of the functionality, then psychologically, then it's like, I'm just not interested. So in the Men's Edge formulation, there are wonderful nutrients that are blended together to really help to support and enhance overall sexual performance, which is key. So in this particular formulation, you have arginine. Why does arginine matter? Because what do we know about this very important amino acid? We know that arginine plays an essential role in the natural release of nitric oxide. Why do we need nitric oxide? Because the nitric oxide actually creates vasodilation. The more vasodilation that you have, the more proper blood flow that you have. Actually, even in the Mayo Clinic, they list arginine just by itself as a potential treatment option for men who are experiencing erectile dysfunction. So we actually have this included in our formulation. It also contains ginkgo biloba. Why ginkgo? Once again, we're looking at that nitric oxide. We're looking for that enhancing the nitric oxide release, hence better blood flow. Now, there are other nutrients that are combined in the Men's Edge formulation. which include things like maca root extract. And the maca we know is very beneficial, not only once again for supporting healthy blood flow, but also for that libido aspect. So this is a really nice enhancement to this particular formulation. It has Icariin in it, and Icariin actually goes by another name. The plant name is horny goatweed. And oftentimes when I would talk about this on the radio and things like that, I was like, I wonder if people are sitting there thinking that I'm making up these names, and I'm not. So it's called horny goatweed, and also known as Icariin. This has been studied extensively in terms of how it's actually working to help to support and maintain a healthy erection. So a lot of the science behind some of these herbs is really quite impressive. And so the maca has been studied in this setting. Certainly the Icariin has been studied in this setting. We also include in this formulation tribulus extract as well as longjack extract. So all of these different herbs, along with those powerful nitric oxide releasing supporters, that ginkgo along with that arginine, really make this an extremely comprehensive formulation for two major factors. For not only the functionality for getting and maintaining an erection, but also for that libido, so for that actual desire aspect as well. And I know it's one of those kind of taboo topics that people don't want to discuss, but this is, for me, coming from a public health background, this is part of, throughout the world, part of people's overall sense of well-being. And I think that this is something that shouldn't be looked at as taboo or just, talked about in a quiet corner somewhere. I think that we need to tackle these things head on. And we know that this is incredibly prevalent, and so many men are dealing with this. And so for many men, maybe the pharmaceutical options are just not ideal. And everyone's heard about the different drugs that are out there for erectile dysfunction. But for a lot of men, they may be contraindicated to try and actually take these medications because of underlying health conditions. So maybe they have, a serious, heart condition, and taking one of those prescription medications for erectile dysfunction is really quite risky. So oftentimes men are looking for other alternatives. And this is what's really nice about the Men's Edge formulation, is it's this really great combination of all of these different nutrients that have been studied in clinical trials to show that they can be incredibly beneficial for the two different aspects. So not only for the libido, but also for the functionality. So I definitely encourage you to check it out on our website. It's the Men's Edge formulation. Oftentimes this can be partnered up with the Prostate HX to make sure that the prostate remains healthy, along with the masculine. That is also very important because the masculine contains chrysin, which we now know is actually very good for your eyes. But the chrysin is really a fabulous herbal extract because it helps to support healthy testosterone levels. And if men are not aware of the fact that they have estrogen, you are, what happens is oftentimes your testosterone levels begin to go down and you start to lose that testosterone into a conversion into estrogen. So high estrogen in men, not a good thing. So what that chrysin does is it's kind of working along that aromatization pathway. And so this is a nice way to help to maintain healthy testosterone. And of course you can enhance this with that combination of the Prostate HX and that Men's Edge. So definitely check that out. I will be back with you in a few more days to talk about some more wonderful formulations available at Invite Health. Thank you.